Hey friends, welcome back in. Veterans Day coming up soon on us, November 11th. And part of honoring our vets for their service is providing world-class health care. And it's right here in our Lexington VA.
Oh, it sure is. Over the next few days, there are several ceremonies and activities for veterans planned. And here to tell us more is the executive director for the Lexington VA, Russell Armstead. Russell, thank you so much for coming by today. We appreciate it.
Thank you both for having me.
Yeah, absolutely. So first of all, let's start with a little background of the VA healthcare system and why you wanted to come in today.
So Lexington VA healthcare system, our mission statement is to improve the lives of veterans, right services in the right place, timely access to high quality care, and then making sure that veterans receive the best experience when they're receiving care from us. But I wanted to come in and share some updates about the services that we're adding to our community clinics, the actual construction and renovation projects that are happening, and then also tell folks about the 5-star facility rating that we just recently received from the Centers of Medicare and Medicaid Services.
Yeah,
so that's the CMS rating. And give folks a little bit of background on that and why it's important to the VA.
It is important because one very significant point is out of all the hospitals in the state of Kentucky, only 5 received the 5-star rating. We're one of them. Lexington VA healthcare system is one of them.
Impressive.
Now, this is important because the Centers of Medicaid and Medicare Services, they use 5 quality measures: mortality, patient experience, readmissions, safety, and then also timeliness and effectiveness of care. The more stars out of 5, the better a hospital performs based on those quality measures. And so if you think about all the hospitals in the state of Kentucky, and then that star rating system in terms of how it measures quality, Lexington VA healthcare system was one of the only 5 hospitals that received that 5-star rating.
That is impressive.
It really is.
Congratulations on that. And just a quick tour of the Leestown campus and the facilities downtown. I mean, it's clear to see that you all have tripled down on care, especially in the last 10 years. The VA is on the move to do the very best they can to our vets.
Absolutely. So we have some construction and renovation projects going on our Troy Bowling campus, which is on Cooper Drive, and then our Franklin Sousley campus, which is located on Leestown Road. On the Troy Bowling campus, well, before I introduce the 2 campuses in Lexington, we are, starting probably around June or July in 2024, Lexington VA healthcare system now hosts the nationally designated telerheumatology hub for the entire Veterans Health Administration enterprise. That's significant because it prioritizes access for our veterans to receive that type of care. On the Troy Bowling campus, we're doing some significant things, and I'll just name a few of them. Our inpatient mental health unit located on the 4th floor of the Tower building. We're moving that to the 1st floor. Back in July of 2024, I think it actually was June of 2024, earlier this year, we started providing a surgical procedure called Mohs procedure, M-O-H-S. So it's named after a general surgeon that actually invented that technique. But it's significant because it starts to address the very high incidence rate of skin cancer in the state of Kentucky. And so we're proud to administer and provide that service. And then if we could focus everyone's attention on the Franklin Sousley campus, we are actually building a radiation oncology facility over the next 3 years that will significantly change the dynamic on the Franklin Sousley campus and add a lot of capability on that campus. And then also we are in the midst of a 3-phase project that adds 5 home-like cottages for our aging veteran population, where we'll provide dementia care, hospice care, skilled nursing care. And so we're very proud of that. We're doing a lot of activity also in our community clinics. We have 4 community clinics scattered throughout the state of Kentucky, mostly central and eastern Kentucky. We have a community clinic in Berea, Hazard, Moorhead, and Somerset. And we are working very, very hard to expand specialty care services to those clinics. Primarily in those clinics, we provide a lot of primary care and mental health services, but we're really active at work trying to add I'll give you an example. Audiology, optometry, orthopedics, podiatry, phlebotomy,
It's incredible.
And
physical therapy.
And you're meeting them where they live.
We are.
Which is so important.
I think
Yes.
the concept is to push more complex care out to those community clinics closer to where the veteran lives,
Yes.
making
Yes.
it more convenient for them to access their
It's
health care benefits.
fantastic. We could talk to you about every single one of these in future editions here.
Yeah.
Time's gotten away from us, Russell, but if you could, give us just a real quick snapshot of what your Veterans Day events are going to look like to honor our vets.
We
on
have a
Monday.
very, very active outreach committee that is going to be all over the state interacting with veterans, really closely interacting with them in a way that we're giving them information about updates about our programs and services, and then also giving them information about how to enroll and register at the Lexington VA
Very
healthcare
good.
system.
And where can folks find out more information online?
Actually, they can go to www.va.gov
Okay.
/Lexington Healthcare, and they can see all the information. It's outward facing, very intuitive.
Yes.
To be able to access that information.
Yes.
They could actually call 859-233-4511, extension 4948, and that will connect them to our health benefits service.
Okay.
And folks will be able to kind of walk them through eligibility, enrollment, and some of the services that we can provide. So
Do make
a lot
it
of
easy.
different ways.
Yeah, no doubt.
Well, thank you so much for coming in today, Russell. We appreciate it. And thanks for all of that you do for our veterans, too. It's
Thank you
so
guys
important.
for allowing us an opportunity to provide some updates.
Send our best to your entire team. Means a lot.
Thank
The
you.
level of care you're giving our vets.
Well, we appreciate the opportunity.
Back with more. Stay with us.